Creating the Perfect Image is presented by David Goldshaw, President, Oshaw Dental Productions.
I'm David Goldshaw. I'm the president of Oshaw Dental Productions, and here we talk about and educate on dental materials. I'd like to be able to explain to you how we're going to look at and work with impression materials, in this case, alginates. Now, it's very important to first off look at our types of impression trays. There's a variety of impression trays we can choose, and in this case we're going to look at the plastic trays versus the metal trays. There's a variety that we can choose from, and most people here in North America and Canada, we're looking, I think most people that again look at asepsis, sterilization, disinfection, use the perforated trays. I like to be able to compare the difference between the perforated, the solid trays, and then we'll look at the plastic trays. Now, think of it this way. The perforated trays, which are considered the most popular types of impression trays in the marketplace, we put our impression materials, our alginates inside here. They're then put into the mouth, and the material flows through the impression trays. So we lose compression inside here. This is taking what we call a mucostatic impression. Compare that to the solid impression tray. The solid tray, which a lot of people don't like using because they thought it doesn't hold or adhere the impression material as well as the perforated tray. Actually, about 5 years ago, the manufacturers made the rims around and also internally thicker, so it actually gives as much, if not better, adhesion than the perforated tray. When we put the impression tray inside here, the material inside here, the alginate, and compress it, it completes and produces a much more compressive impression known as a mucocompressive impression. So if we compare the two, we get more definition with again a solid impression tray versus a perforated impression tray. So with our choice being for a regular dentition, with all the teeth being there, we want to have a mucocompressive impression tray. The solid tray is our choice. When we have partial or edentulous cases, we should be using our perforated trays because we don't want to compress soft, flabby tissues. Now let's have a quick look at our plastic trays, and these are considered disposable. They come in this case as a half arch, of course, full impression trays. The difference between these is I go into a lot of dental offices and I see what's happening. They actually put these into a cold soak solution overnight, whereas they're considered disposable. Disposal means you throw it away after each use. The problem being that since it's a plastic, a shiny surface almost, that they don't get quite the adhesion that you normally need to use. So we should be using a good adhesive inside. So in order to do that, I'm using a vegetable-based adhesive called TAC, T-A-C, Tray Adhesive Compound, from a company called Bosworth. It does actually come with two of these little depressors, and it's nice and easy to use. So I'll just make sure that it's simply adhered. By spraying this lightly onto the surface, I then wait 1 minute, and then I can apply my impression material down inside. And no matter how hard I try afterwards, it will not separate from the tray. It stays within. So it means to say that the trays have to be thrown away afterwards since we can't clean out the material. So that's looking at the impression trays. Now we're going to have a look at how to mix an alginate. Let's talk a little bit about alginates. Most alginates nowadays are pre-packaged inside bags such as this. Why? Because it gives it a longer shelf life. There's a small amount of vacuum inside, and in this case we have 5 years shelf life, which is good. So it's going to keep us away from obviously any type of impurities getting inside. The problem being that as soon as we put it into a container, a canister like this, as soon as moisture gets inside, it can contaminate or change the flow of the properties of the material. So we want to keep the lid on pretty much at all times. Handling the material. The alginate itself will settle since it's made from 3 different particle sides, and it does need to be fluffed up. The incorrect way of fluffing an alginate is by doing this or by doing this to the material. It hurts the material that's inside. When alginate is manufactured, it actually is made in 3 different particle sizes, which are all soft and round, spherical shaped. The material itself, if we ever had to shake it up like this, those particles bang against each other and break, and they become like jigsaw piece puzzles that don't fit together. We've just changed the working time, the setting time, the dimensional stability. So to fluff an alginate, any alginate, we put it onto its side, the canister, revolve the canister 3 times. Once it's gone through 3 revolutions, it's fluffed. What we should be seeing that when we open the can, the lid, we shouldn't have clouds of dust that exhume out there. That dust, which is made from a material called diatomaceous earth, can enter into the lungs and cause a problem of silicosis. So we try to stay away from that. So, handling ability. Always try and make sure that when we're working together, we keep our alginate bowl separate from our stone bowl. That means to say we need to have 2 different styles of bowls. In this case, I'm working with a very thin, flexible type of bowl material. And the same thing for our spatulas. Our spatulas themselves are very flexible, and these are a nylon-based material which can be heat sterilized. So let's have a look at how to mix the alginate. Now, before I normally handle any type of impression materials, normally the thing I'm going to be doing is washing my hands. Washing my hands under the sink, I normally use warm or hot water. So what will that do to the water that we're going to be measuring off our alginate afterwards? It means to say that normally that's going to be warm or hot. And how's that going to affect the alginate? It's going to accelerate the set, which is no good. So instead of using the preset water measures that come with the material, I've got one of these little gadgets which are called the H2O dispenser, and this actually comes from the Maytech manufacturing company in California. Great little idea. Now, there is actually a holding area for the water, and as I squeeze this with a light pressure, the water is pushed through a straw in the center. As the water's coming out of the straw in the center, it comes to this little white cap. I then let go. It then sucks back to the perfect amount of 2 scoops, which is preset. If I want to change it for 3 scoops, I would turn it this way, 1 scoop back the other way, so I can always vary the amount from between 1 to 3 scoops. It's also very good for tequila, vodka, whiskey, I hear. So, let's take hold of our bowl that we're going to be mixing, and I can put the powder in first, but it's actually more comparable to put the water into the bowl first. In this case, I've got room temperature water and the perfect amount from our H2O dispenser. I'm now going to take hold of our alginate. In this case, I'm going to be using the Kromatica color change material. This powder itself is fast set, but it's still going to give me enough working time, etc., to handle the material. Now, prior to doing this, I've just put the powder scoop back inside, and I'm just closing that for the moment. I'm going to be using our impression tray, which is the solid tray. But what I'm going to do, instead of using wax at the posterior borders to dam it in, and if I didn't do that, what would happen is the distal area would be lost as the material's flowing out the back, and of course down the throat and on the tonsils, etc. We want to stop that from happening. So let's show you what I'm going to do. I'm going to use a material which is called Damit. Damit is a great little material. It's actually a fiber-based product. As I pull off a small piece of material, close this off, I then apply that to the posterior border of the tray. I then fold this over with a light pressure, and it's now sealing the back of the tray. And in this way, it's going to hold the material within the tray, allowing it to obviously compress more and picking up the distal areas which are normally lost as the material drags or flows out the back of the impression tray. So our tray is prepared. And this is what I would normally do. I have my patient who's sat in the chair, and I'm going to relax them because they're very nervous to start with. The best way to relax them is give them a glass of room temperature water. It relaxes the patients. You can see them bodily relaxing. It also helps to wet the mouth, which of course when we're using an alginate is going to break down the surface tension. So that way I will not now have to wet my finger on the surface of an alginate, which a lot of people out there are doing. And in this case, it's going to produce a much smoother surface. Now, if the patient's a little bit elderly, or if they might have a thicker, ropier saliva, that room temperature water that they're going to rinse through will be broken down as well. So, I'm now ready to mix the alginate. So let's take hold of our spatula. And in this case, I'm going to take 2 scoops of the material, so packing the scoops tightly. Because I revolved or tumbled the canister 3 times, I don't need to tap on the surface of the scoop that's normally taught in most schools. I now slide off the amount, and I'm going to do this twice. Apply that into our bowl and do the same thing again. And at this case, I will then close back and then start to mix the material. As I combine the two together, I want to see that I get a good homogeneous mix. Now, as I'm starting to mix, this material, of course, is a color change material, so it shows us when we're fully combined together. I wet the material first, and then I continue spatulating until the material starts to moisten and wet. And I'm now just pushing the air from the mix. Now, at this point, I've got our material that's mixed. I'm going to take a small amount of the material, and just to show you how we got a good mix of material, this is what we should be looking for. It's dense, it's thick, it stays on the spatula, it doesn't drip off. I normally take a small amount of the material on the back of the patient's hands and tell them to watch this whilst I'm going into the mouth to take the impression. So it's sort of, again, distracting them. So I'm packing my impression tray, and I'm now ready for our impression. So we're normally going into a wet mouth environment. As we go in, we apply a small amount of pressure, and normally I'll be pulling my lips down over and then muscle molding, getting a good functional impression. This material, as being a color change, as we can see, it changes from purple to pink to white. When it's white, we know the material's set, and that's normally within 60 seconds with the most alginates. But in this case, with this material, I've still got the same working ability, but it's only 20 seconds, so it's much faster, kinder to the patient. After the 20 seconds, we'll see the material again starting to turn white. We know the material's set. Now, of course, if this was inside the mouth, the warmth, the humidity of the mouth has a tendency of accelerating that set. So I'll just leave this for a moment longer, and we can see that once the material's set, it can peel off without obviously sticking to the skin. The same case with our mouth. So I'll just let this a moment longer, and then we're ready to set and separate it out. So normally we would then withdraw from the mouth, and we end up with a nice, smooth, clean impression. At this point, we want to have a look at two things. Obviously looking at the accuracy of our material, but more importantly, let's look at our trays and our bowls. We have over here dirty bowls and dirty spatulas. We want to clean them. So the nice thing about this material is it cleans very well from the spatula, and the same thing from the bowl. So just a light pressure and away we go. So we've now cleaned up nicely, and let's look at how to store our material. Now, most alginates on the marketplace store for around 6 hours. That means to say if we don't pour them quickly, the material itself has a tendency of contracting, shrinking, and changing its accuracy. This material is actually, through the manufacturing procedure, they coat the particles with a polymer through the manufacturing procedure. And so what that does, it keeps the condensation, the moisture present within the material. When we're handling the material, it still handles a little bit thicker but nicer to work with, and we've got a nice set. Now, once the material is set like this, we have an accuracy of 4 days. Now, in order to keep that accuracy, what most people would normally do is take hold of paper towels, Kleenex, etc. They then normally wrap them around the impression and wet them and then bag them. 5 years ago, that was the case. We could do that safely, but not anymore. Things have changed because the paper we're using nowadays is recycled. When it gets wet, it's made to break down, and then fibers will actually depart from the surface and impart into the alginate impression surface. So that's no good, because otherwise what would happen is when we pour up a model, we'll touch the surface of the model, and where it hadn't set correctly, we would have a thin residue of stone on our fingers. What we do need to do is wet the paper towels, place it underneath the impression, so not wrapped or not on the surface, and then we can put it into a Ziploc bag or a Tupperware type of container, something that's airtight, and it will hold it for 4 days stability. So from a Friday right through to Tuesday the next week, no problems. Long weekend, you can go ahead and enjoy it and come back, and you've still got a good, clean impression that's still accurate as it was from day one. I'm now going to explain to you, instead of the hand mix, we're going to use the machine called the alginator. This is a bowl that revolves around and actually does the mixing for us. It takes out a lot of the stress of having to compress the impression material each time, trying to get out of the air bubbles. This operates on 2 speeds. There's a low and a high speed. You also notice that there's the alginate bowl and there's a larger bowl. The bowls add and detach quite easily with like a bayonet fitting. So it's possible to, again, to mix up stone, which we'll show a little bit later on in this procedure. So let's show you how to mix the alginate using the alginator. Now this is especially good if we're doing a lot of mixes in a busy office where we're taking a lot of impressions for whether it be from a case of impression trays, obviously for where we're doing bleaching trays, mouth guards, or it could be many other things. So I'm going to measure off my water. Again, I'm going to use this little H2O dispenser. And these are things you can pick up from your local supply company. This is around $29, just to give you an idea. So as I squeeze this, it's going to measure off our 2 levels of water, which I'm putting directly into our mixing bowl. I'm going to do the same thing again for our alginate. So packing our scoop tightly, sliding off, and then the same thing, doubling that up twice. Now the first thing I do is lightly wet the material that's inside the bowl. Once everything is moist, I'm going to turn this towards you so you can see, because right now you're probably wondering what's happening inside the bowl. So let's revolve that around a little bit. So on the low speed, I slide the spatula to the bottom 3 times. 1, 2, and 3. Whatever wasn't mixed on the spatula, I'm going to pick up with the tip and drop it to the bottom, and do the same thing again now on the high speed. So just lightly slide it to the bottom 3 times. 1, 2, and 3. When everything's mixed, I'm going to pull out the material by sliding the spatula up the side of the bowl. And that's a simple way of how to use the material. At this point, I'm now going to unload the material. Again, taking a small amount of that material on the back of the patient's hand. And at this point then I can actually ask the patient to say, watch whilst this turns white. I'm then going to go into the mouth to take our impression. Again, another 20 seconds inside the mouth, nice and rapid. Now, this does have a choice of mint, cherry, or bubblegum flavoring. We can choose. I prefer personally the cherry, but in the case of working with a material that has a flavoring, when this goes into the mouth, the flavor disappears and it's just leaving a scent. The idea with that is it actually makes the patient still think there's flavor, but it cuts down on the salivation so they don't produce saliva with a mouthful of impression tray and material and then saliva when they end up gagging. So this now becomes a little bit more gag resistant, which of course is much kinder to the patient. So after our 20 seconds, we're then going to obviously open up, and then we'll talk about how to pour the perfect model. I've just changed over my bowl from I'm going to be using the alginator to mix up my stone. So again, I've just changed over from the alginate bowl that I was using previously to the stone bowl. Again, I can obviously do the same thing as if I wish to by mixing by hand, but again, let's just give you an idea of how to mix up the stone and how to get the best possible mix. Now, most of you probably out there eyeball it, so rather than guessing this, we're going to measure our water. So for every full impression that we're pouring, we're going to use the same amount of water that we would normally use for our alginates, in this case, the second level. So instead of using the water measure, which again might interfere with the temperature, I'm going to use room temperature water that's kept inside the H2O dispenser. Again, to accelerate stone set, rather than using just hot water, a quarter teaspoonful of table salt. We would then add that into our water and then make sure it's fully dissolved. And then when we go to use it, it's going to accelerate the set. So normally quarter teaspoonful inside, pour the water in, dissolve it, and then add your stone, and that's going to accelerate it. Alternatively, there's something else which is called using slurry water, and that's where we would, if we have a model trimmer in the office, we grind against the surface of the model trimmer and collect the grindings, which come in like a slurry, a sort of a milky colored water. Collect that, and instead of using our regular water, use the slurry water to mix. It accelerates the stone. The only problem with that is there's a little more contraction, expansion, so it's changing the dimensional stability of the stone, whereas the table salt doesn't change that at all. So let's go ahead and do the mix of stone. So Second level of water for our regular impressions. Again, if we've got a large impression, we want to change it to 3 scoops, or a single scoop if we've got a half impression. So I'm just now measuring my water. Once it's up to the white cap, again, just release, let go. And now put our water into the bowl. Now at this point I'm going to use our stone. In this case I'm using a green stone. This has quite a long setting time, but again it's got a nice working ability. What I'm going to do at this point is slowly sift the stone onto the surface. The stone will absorb into the water, and I'll turn this towards you in just a moment so you can see what's going to happen. It's going to reach a point where it saturates. That means to say that the water will absorb that powder that I'm pouring in. And the way that we know how we've got the best working ability is that on the surface of the stone we would have a small dry area and it would look almost like cracking. So let's combine these two together and show you what I'm talking about. Now, it's still absorbing inside, but let's see if I can turn this towards you, you can have a look inside. It almost looks like there's a small amount of cracking on the surface. I don't know if you can pick this up on the camera. Inside there. So there's cracking on the surface. Now when I combine these two together, I'll end up with what we are looking for is the best ultimate mix, as if it was done measured by weight and by volume. So I'm just combining these two together, and this is the type of mix that we should be getting. It looks somewhat dry, but we do want to have a dry mix. Now after we've combined these two together, I'm going to put this back onto the alginator, and then I'll turn this around towards you. I'll do the same procedure that I did previously. So lightly slide this down 3 times. 1, 2, and 3 times. Just making sure that everything was picked up. Drop to the bottom, and then the same thing on the high speed, the same procedure. And at this point we have all our material mixed. We're now going to be taking out the material and slowly vibrating it into our impression. Now, very important to look at our impression first off. We want to make sure that the impression had been disinfected. Normally that's done as soon as we've taken the impression. We'll spray it with a disinfecting spray, but making sure that if it's a very fine spray, there's no way that a fine spray will reach the bottom part, especially for lower anterior teeth that are long and narrow. So if it's possible on a sprayer and it has a chance of changing the coarseness of the spray, do so, because we want to have large particles that are entering down inside. The contact time is again according to the manufacturer of our disinfecting solutions. So normally it's anywhere from 5 to 10 minutes. Then we rinse it under the tap, shake off the excess, and then we're ready to pour. So what I'm going to do first off is take a small amount of our stone and start using the dental vibrator. The dental vibrator, in this case I'm using the Whip-Mix general purpose vibrator. It's just around $100. It's very well priced. As I turn on the unit, it has a variable speed over here from low to high. I put it on a medium setting, not high. Hold the tray on the surface of the vibrator lightly. Don't hold it down hard, because if you hold it down hard, let's turn this off for a moment so we can hear. If I hold this down hard, what will happen is all the vibrations travel through the tray into my hand, into my arm. It feels really good, but it doesn't do anything for the impression tray. I want to hold it down nice and lightly. So let's turn this back on again. Put a small amount of that stone on the surface and just allow it to seep in. Take a little bit more of that material and do the same thing again. Now at this moment I'm just allowing the stone purely to enter through the teeth only. Notice I do not want the stone to vibrate at all at a period of time too long. That's it. I do not want to vibrate anymore, so let's turn this off. One of the worst things that you can do is taking your bowl with a mix on top of the vibrator, and I see every office doing this. They watch all the little bubbles come from the surface, but what it's going to do is actually take more air from around the surface of the bowl, put it back through the mix, and so you're actually aerating the mix, which is really what we don't want to do. We want to try and squeeze all the air out. The vibrator that we're using is just a method of transferring the stone into the impression as quickly as possible. So the longer we spend vibrating the stone in, plaster in, we're going to produce more bubbles. So again, eliminate that time. Try to cut it down. So let's come back. I'm going to put this back onto the alginator. Once it's secure on the alginator, I'm going to take off a small amount of the stone and place that into my mold. So at this point I'm just building up the amount, and this is going to be my base. So I've now taken out all the stone from the bowl. Let's give you an idea what's happened. That's how much stone is left behind, nice and clean. At this point I want to ensure that my stone that I've mixed, there's still a shiny surface. That's where the material is still starting now, obviously, to go through its initial set. Once it's reached the initial set stage, that shiny surface disappears, and the material, of course, becomes a lot thicker. And that's the point where I want to shape the top of the model that I'm forming. So I'll let that set a little bit longer, and we'll come back as soon as that's happened. Our bowls, we want to just make sure there's no residue left inside. So what I'm going to do is use a material that's called the Mizzy PIP spray that's available from your dental supplier. By spraying this inside, wiping with a Kleenex 2x2, gauze, whatever, or in this case, Kleenex, and just lightly wiping through, just removes any residue that was inside the surface. It imparts a non-stick, almost like a silicone solution, and also disinfects the bowl. So now I know I'm safe, ready to go. So our bowls are nice and clean. We can put our alginator aside, but come back to our model. So again, we've waited for that surface shine to dissipate, and then we can actually smooth now our surface and begin to shape our stone. And this is going to save us a lot more time than later on, when the stone will be hard. So I'm just lightly going to flatten out the surface. I'm still going to have enough base, which of course is very important. We need to have a good base on our model. But I'm just flattening the surface over here, and I don't have to spend a lot of time on this. Trimming off a little bit of excess where necessary. As I say again, this just literally will save us time later on when we are on a model trimmer. So it just reduces that period of time that we would normally spend on the model trimmer. So we'll come back to this after the stone itself has set, and carve a little bit more off over there. Just making sure the surface is nice and flat so that once it rests on a surface later on, it doesn't fall around. And I will leave this then to set, and then finally trim once the stone has been separated from the impression. Now the nice thing about this material, remember I said it has 4 days stability, but it also, I can re-pour this twice. That means I can actually get 2 models, a working model, study model from the same impression. There are a variety of different ways of keeping our trays nice and clean. Now of course that's more important when we're talking about our metal trays. Remember, our disposable trays are a one-time use. But we need to clean the alginate as well as the stone and plaster. Of course, it's much more difficult with a perforated tray where the alginate's seeping through the perforations. So what we should normally be doing once we've removed our models, separated them, and ready to clean out the impression tray, break off all the material from the external portion of the tray. That means literally with a finger or a knife, but usually a finger's better. Just literally pull off all the little nodules of the alginate away from the tray, and then it's much easier to pull out the impression tray. the impression material that's caught inside here. Then they go into a soak solution that's going to remove any residue that was left inside. The general tray cleaner from Bosworth is probably one of the best effects. I've tried pretty much all the systems out there, and this produces a nice, shiny, clean surface of the impression tray. One capful, these crystals dissolve very quickly, so just a matter of dissolving them through. In your regular bath of water that you're going to be putting this into, it dissolves fast, and then they're left to soak. Anywhere from 10 minutes through to, you can leave it in overnight, but most times within a couple of hours. It just will remove any residue of stone, plaster, as well as alginate. To conclude this portion of our impression taking, we have covered the types of impression trays, how to care for them, what the differences are between the trays, how to handle an alginate, how to mix an alginate, and then also stone and plaster handling as well. And I'd like to talk to you today about making bleaching trays and mouth guards. In front of me I have one of the vacuum form systems. Now there's two forms of, let's say, thermoforming. Thermoforming is where we have sheets of material, which in this case we're having a look at the 040 bleaching tray materials. A variety of other products are out there, such as the mouthguard materials. And these again come in varying thicknesses. They run in materials which are normally EVA, ethylene vinyl acetate, as well as PVA as well, polyvinyl acetate. Most of the materials nowadays are obviously safe and easy to use. We're going to use these materials again in the case of thermoforming, where we heat the materials. So in this case, I'm working with a heater that's on this machine that heats up the sheet of material. And in this case, it's a vacuum former, so it actually sucks it down over the model. In other cases, they use pressure forming, where they push it down. So something such as the variety of systems out there that are used in pressure forming. There are lots of Druformat is one of the different products that are out there. And in this case, I'm using a product from the Keystone industry. So let's open up the machine and apply a sheet of the material, and this is how we would actually load the material into the system. So as this lifts up, I would apply this in easily and simply so it centers into the area. I then lock that into place. Now, very important, my model itself. You'll notice in this case I've removed the pallet. Now, if we didn't want to remove the pallet, we would normally take hold of our model that we've fabricated, and then with a cross-cut rosehead burr, drill a hole through the model itself, and that allows enough vacuum or pressure that we're using to thermoform our materials, to adaptation. Because if I didn't do that and I just simply put that onto our table and try to adapt down, what would happen is it would adapt around over the labial surfaces, but down in the pallet, in the case of this maxillary model, it wouldn't adapt very well. So I would need to gain more vacuum or pressure. And so that's the reason why in this case I've removed the pallet. Now, I also want to use, in this case, a very special pencil. It's called an indelible pencil. The indelible pencil, by lightly passing that through the gingival sulcus, marks and stains the area present. Now that's important because I want to see that when I'm trimming later on, and I want to know exactly where to trim to. So I can do other things with the indelible pencil, such as write patient information, patient's name on the model. So once I've written Mrs. Smith's information, I then put this under a tap, underwater, and it stains the surface. This is like, because they call it ink in the bottle, so it will actually stain, permanently mark. These pencils run normally around about $3 a piece, and they last, well, this one's a new one I've just opened up, but they last normally about 2 to 3 years. I'm now ready to vacuum form, so what I'm going to do is place my model centrally onto the table, like so. So let's lift this up first off, and then place this centrally onto the table. I then swing over my heater, making sure that I would turn on my heater. The light comes on the system telling me that it's heating. Now, varying different times according to the thickness of materials. If I'm using a thicker material such as a 0.15 or a 0.12 of the mouthguard materials, it's going to take me on average between 12 to 15 minutes to heat. Whereas when I'm using one of these 040, much thinner bleaching tray materials, it's going to take me only 7 minutes to heat up the material. So the first thing that happens, and let's hold up another piece of material just to give you an idea of what will happen when it's heating. The first thing that happens, it actually goes upwards to the heating element, and then it goes a little bit wavy, and then it droops down. And from the time it droops down, we want to actually let it drop around 1/4 of an inch from the bottom part of the vacuum forming unit. Once it's going to do that, then we know we've got sufficient timing. Presently, it's now going through its stage of facing upwards. Again, because I've just turned the system on and it's obviously a little cold to start, but again, it's heating through. Once it's heated, then as I mentioned, it will go that little wavy pattern and then droop downwards. And that's the part where we've got to watch and remember our timing on this. The unit now is achieving more greater heat, and it's now starting to drop down. So I have to be careful, stand by. Once I've achieved enough droop, and you'll see in just a moment it's starting to get our perfect point, we'll then turn the system on for vacuuming, and I'll show you how that works. We've now achieved enough time. We've now got a 1/4 of an inch drop. At this point now, rather than turning the machine on, I'm going to lower this down over and turn the vacuum on. I normally allow a good 20 seconds for the vacuuming to take effect, and this is to ensure that I'm going to get perfect adaptation over the model. Once the material, of course, has then cooled sufficiently, I can then remove it. There are a couple of sprays available in the marketplace which we can spray on the surface. They work nicely again to cool the material and contract it onto the model even greater. I turned off the heater, I turned off the vacuum, and now I can release by pulling this upwards and removing our vacuum formed bleaching tray. At this segment, we're now going to show how to trim a bleaching tray. For trimming our bleaching tray, in this case, I'm going to, instead of use the pair of scissors, in which case what a lot of people do is actually pull the bleaching tray away from the model, and the problem with that is you can deform or stretch the material as you're pulling it away if there are a few small undercut areas which grab hold of that material, and so you can stretch it. So what I prefer to do is actually trim it on the model itself. In that case, I'm using an instrument called the razor tip. Now this is an item that's made in Canada, Saskatchewan. The company puts it out, has 2 different styles of units. I'm using this dual unit which actually has a facility to hold another tip in the case. As I look through the information on the razor tip, I noticed that I can use one of the various tips that are available. As you can see, there's lots of different tips available. The most common one that I have inside there is this one over here, which looks a little bit more like a scalpel blade, and it's perfect for trimming bleaching trays, mouthguard materials. So the razor tip I'm going to remove. I've got the unit turned on to around 4 1/4, and I'm going to start trimming. I normally start posteriorly and work again all my way around. So as I start, I'm going to use a scalloping motion. So this is the style of movement that I'll use, and I'll trim all the way down to the surface of the stone. So with a light pressure, allowing the heat of the unit, the tip, to penetrate through our thermoforming material as I scallop my way around. So let's just see, I've just gone almost halfway through and peel off. And this is exactly what we need to look at and see that we've got a nice smooth edge that's actually reduced itself over. So that edge is going to provide, again, a nice, smooth, comfortable fit inside the mouth, but more importantly, something that the patient will feel very comfortable when their tongue is over the surface. So not something that's going to interfere. I'll finish trimming this up and we'll come back in just a moment. Once we've used our razor tip to cut through around all the area, we would then just pull off all the excess, and within 45 seconds we can make a bleaching tray. Now this compares to trimming it manually with a pair of scissors or by using a hot knife and a torch to around 10 to 15 minutes. So hey, listen, 45 seconds, great way to go. If there was any residue that's left on the surface of the tip, what I normally do is turn this up to the full extreme of the heat, and that would just burn off any material that was caught on the end of the tip. It's a little bit like a self-cleaning oven when you raise the temperatures. So now we've got it nice and red hot. We're again just making sure there's nothing left at all on the tip. At that point now, our unit's now ready to use for the next time around. So I can then turn off the temperature, turn it back down to again, and off. To remove any sharp edges of the bleaching tray itself, leaving this again firmly seated on the model, we're going to use the microtorch. Now the microtorch is something that uses the butane gas. Looking at the base is refillable, so that we can always refill should we need to. Something you can get from Canadian Tire, one of the hardware stores. And when we're ready to use the unit, I turn this on, push the button, and then I'm going to use passing motion backwards and forwards, and this would slightly melt the surface of just the edges, the fine edges of the material, and that just gives a rolled edge. So when the tongue comes into contact for this, it feels nice and smooth, so rather than feeling something that's sharp and again obtuse to the tongue. I then let this cool, and we've now finished our bleaching tray in a matter of moments. I'm going to be showing you a material which is called the temporary crown matrix buttons, but we're going to be using this for a different purpose. This is a thermoplastic button. That means to say when we put it into hot water or apply heat to it, the material itself softens. We're going to use this to make a bleaching tray. So instead of making an impression, so we don't need an impression tray, we don't need alginate, we don't need to model, we don't need to vacuum form, we're going to use this. And you can actually get samples of the temporary crown matrix buttons from the company called Advantage Dental by phoning this number, 1-800-388-6319. They'll send you a sample, so let them know. So, normally we'll be using this directly in a patient's mouth. I would take 3 buttons, apply 3 buttons into our mixing bowl, and they sit in there for 15 seconds. How do we know? First off, the temperature of the water, very important. It should be in between McDonald's and Tim Hortons, about 150 degrees. The best thing I find is either, if we're not using one of these guys over here, an electric kettle to warm up our water, is use a microwave. And in the microwave, take a regular ceramic cup, fill it 3/4, half full water, put it into the microwave for 2 minutes, be fine. The water itself should be sufficiently warm. Once the material itself is ready to go, it will form itself and turn clear. So it's changed from being white to its clarity, clear. At this point then, I would then roll it out into a small thin sausage and adapt it down over, directly into the patient's mouth, over the teeth. So all we'll be using is our gloved fingers with a light pressure, placing it down over the teeth. As I'm adapting it down over, like so, slight pressure, so the patient just feels a nice warm material. It's not hot, it's just warm to work with. It's very comfortable. So I'm just pushing it down lightly, interproximally, with small spaces, and then with a light finger pressure over. I then take my air water syringe and then lightly over the surface of the material until it turns white again. So it's normally about another 15 seconds. Total time here is 30 seconds inside the mouth. It's very quick. So once the material has turned white, it's now sufficiently cooled, and we can then remove it from the patient's mouth. So with a light pressure, you'll notice that it does fit a lot tighter than a bleaching tray inside the mouth. So we remove it, and we're left with an easy material. We can trim this with a scalpel blade, with some scissors, or even using a straight handpiece with a cross-cut rosehead burr on there to trim in between. And that's how to make a bleaching tray inside the mouth immediately. The whole system is very fast and very convenient. It's going to run you about $2.40. I'd now like to talk to you about how to identify a mouthguard, a bleaching tray, or even a denture. I'm talking about putting information on that to personalize it for that patient, should there be a problem, allergic reaction, or whatever. Normally it's very difficult to do so. Normally we'd have to grind a channel, let's say out of a denture, conveniently, so grind it away, and then put a strip of metal imprinted with information or muslin cloth, put it back in, cold cure over. All that takes a lot of time to do. So instead of that, we're going to have a much simpler method. We will go to and pick up an indelible pen. Now that can be like a Sharpie style of pen you can pick up at any of the major stores out there. And make sure it's a fine tip. Write the patient information, allergic reaction, name, in a convenient area out of the way. Let it dry. Once it's dried, we're going to take hold of this kit. Now this is called the Bosworth Gorilla Seal Kit. And inside are 3 of these syringes. Pop one of the little fuzzy tipped ends on the surface of the syringe. Squeeze a small amount until this is moist. And then apply a small amount of that mixture just over the area we've just written. Once that's done, we take hold of our light curing pen. And here I have a little curing light that comes from the company itself is called Spring Health. It's a cordless light. I then place this down over. I then cure normally for 20 seconds. Once it's then cured into place for the next 5 years, we have permanently marked the information onto that appliance, whether it be the denture, the mouthguard, the bleaching tray. So that's a simple way of how we can actually establish information onto the appliance. Well, we've now like to conclude. We've talked about bleaching trays, mouthguards, how to fabricate them, how to get the best out of taking impressions, and we'd like to again thank you for your warmth and listening ability over here. If there should be more information, please contact Shaw Dental Productions. Thank you.
Creating the Perfect Image has been presented by David Goldshaw, President, Oshaw Dental Productions.